Amen Clinics in Scottsdale is transforming how mental health is diagnosed and treated. Unlike traditional psychiatry that just focuses on symptoms, they're meeting you with science, using brain imaging, lab testing, and a comprehensive clinical approach for every individual patient. We're here at Amen Clinics to talk with Dr. Mark Anderson about the incredible life-changing things that you are doing for children and teens all across the valley. Now, Dr. Anderson, we really want to ask you what it is that tends to be the challenge for most families when they're trying to get behavioral diagnoses or mental health diagnoses for their children and teens.
Every person is unique, and certainly every child is unique. And we know that, every child's mental health struggles are unique, right? And mental health issues present differently in children than they do in adults. And if we are only looking at symptoms or trying to treat diagnoses, we may find ourselves lost, confused, failing medications, frustrated. And so if we can actually take a look at the brain and we can see what's going on in there instead of just throwing darts at a dartboard, right, then we're able to more accurately and more quickly get to the bottom of what's going on and provide the right treatment.
What really sets you guys apart when you're doing these brain analysis scans?
That's a question I actually get asked quite a bit. I have actually came up with a fun little answer for it. So it's the 3 T's: time, training, and technology. So with time, right, by getting to the bottom of things, we save time. Right? We save time, we save money, we save frustration, but we also get a lot of time with our patients. So, in a traditional psychiatric setting, you may only get 60 to 90 minutes with a psychiatrist. They're going through all the history, they're trying to come up with a treatment plan in a very limited amount of time. We have a very thorough evaluation process. You spend 2 hours with your patient outcome manager doing a very thorough, detailed history. We're doing psychological testing, and of course we're doing the SPECT scans. And so this gives us a wealth of information beyond what you might get elsewhere. And then I, as the doctor, I get all of that information before the patient even walks into my office. And then I get 2 hours with them to build rapport, to get to know them, to ask any questions that I might have, to review the SPECT scans, of course, and then to come up with a really comprehensive, holistic treatment plan. And I think a lot of other psychiatrists would definitely do the same if they simply had the time.
I'm a firm believer, especially when you're doing something totally different in an approach like you are here at Amen Clinics. Results speak louder than words. Can you share with us a success story from one of the young patients that you've had the opportunity to work with?
The one that comes to mind right away, young man, about 9-10 years old, really severe, complex psychiatric condition, all sorts of symptoms ranging from obsessive compulsive disorder type symptoms and psychosis, insomnia, autistic symptoms, all of which kind of started very abruptly, and it didn't really fit any typical picture. He'd been to many other providers before, trialed and failed many different medications. He's autistic, he's schizophrenic, all these different diagnoses. And again, because of the 3 T's, when they came to us, mom was about ready to put this young man in a group home. And when they came to us, because we had the time, the training, and the technology, we were able to view the brain, see what was going on in there. We were able to get a really thorough, in-depth history that helped to paint a different picture than other people maybe have seen before. And then, of course, with the training that I've received, both in medical school and residency and fellowship, but also through the Amen Clinic, was able to think outside the box. And after some comprehensive genetic and testing the SPECT scans, what we actually found was that he had a very severe chronic case of a rare but probably underdiagnosed condition called pediatric autoimmune neuropsychiatric syndrome, which a lot of people know as PANDAS, right? And when we discovered this, it changed his entire course of treatment. Right? So we were able to start him on some steroid therapy. We were able to start him on antibiotics. We were able to adjust his medications. And now he's thriving. I mean, we still have a lot of work to go, a lot of things to do, but it's a marked difference. And he's certainly not going to a group home anytime soon.
Absolutely. And you said, you know, it changed his treatment. But really what you guys did was you changed his whole life. You changed his family's life. And if this sounds like something that you're interested in, there is a special offer happening right now for our Your Life Arizona viewers. If you'd like to take advantage of that, go ahead and call the number that you see on your screen or head over to their website.